Hey Scott, how are you doing today?
Doing good, right here.
I'm doing well, thank you. My name is Manny. I'm a student physical therapist, and I'm going to be helping you get out of this bed and into this chair today, okay?
Sounds good.
All right, so we'll start. I'm going to take this sheet off you. Scott, what we're going to start doing is learning how to move around in the bed a little bit easier, okay? So first we're going to start by taking our arms, crossing our wrists, and we're going to keep our arms just about a little lower than chest level, because if we bring them too high, they'll fall back. They can hit us in the face. So this will give you better control.
Okay.
And what we're going to do is we're going to start rocking back and forth, creating momentum with our upper body and our arms.
Okay.
And once you're comfortable with that, on the count of 3, we're going to take our arms and roll towards the right onto our side, okay?
Okay.
All right, here we go. So 1, 2, 3, go. Good. How's that?
Good.
Okay. So next, Scott, what I'm going to do is I'm going to place your hand and arm right here. I want your fingers bent and your palm down on the surface of the mat.
Okay.
So keep that hand position, and what you're going to do is you're going to press into this hand using these pec muscles.
Okay.
I'm going to assist you lifting up, and you're going to bring this elbow underneath your shoulder, okay?
Okay.
All right, and we're going to go up on 3.
Okay.
All right? So here we go. You ready?
Yep.
1, 2, press, and pull. There we go. Right. That right there. All right. Okay. So next, what we're going to be doing is we're going to be going into a long sitting position where our legs are flat out on the table and our trunk and head are upright. And how we're going to do that is we're going to start walking our hands up towards the table near your knees, okay?
Okay.
In order to do that, we're going to have to press our weight into this hand and unweight this arm.
Okay.
All right, so let's start by bringing this hand here. Again, we're pressing through this arm using this muscle.
Okay.
I'm going to give you assistance, and we're going to bring this elbow up, okay?
Okay.
All right, so 1, 2, and 3. Let's do that again. So let's walk the hand up there. Okay, you ready?
Yeah.
So 1, 2, 3, press through there. Bring that down. Okay. So what I want you to do now, Scott, is I want you to take this arm, hook it underneath your leg, and I want you to use your biceps to try to pull your body upright, okay?
Okay.
And we're going to go on 3. So 1, 2, 3, pull, 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 pull. Good. And I'm going to teach you a way, if you're sitting up in this position, how you can remain upright in a comfortable position. You can take this hand, and you can fling it back like this, okay? So, back here, keeping that elbow straight, and then the same with this, okay?
Okay.
So next what we're going to do, Scott, is we're going to start shifting our hips and our legs towards the edge of the bed. So we're going to have our legs positioned off there. Okay?
Okay.
So first what I want you to do is I want you to bring this hand right here, this hand a little bit closer, because we're going to be pushing through this hand on 3,
Okay.
and we need enough space on this side for our hips to go towards the edge of the table.
Okay.
All right? And I'm going to be on the side of your hips to help shift you towards the right, okay?
Okay.
So when I say 3, you're going to be pushing on this left hand, and then we're going to shift the hips towards the right, okay?
Okay.
All right, you ready?
Yeah.
Okay. So with your head, you can start creating momentum towards left. There you go. So use your head. We're going to go on 3, okay?
Okay.
So 1, 2, press, 3. Good. And then we're just going to reposition, okay?
Okay.
Hand here. Hand close to this hip. We're going to do that again.
Okay.
We'll go on 3, okay?
Okay.
Head movement. 1, 2, press, press. Good. All right, now what we're going to do, Scott, is we're going to use this hand right here.
Okay.
And I want you to, drag these legs towards the edge of the table, okay? Good. Okay, so right there. Okay, we're going to reposition. Okay. So what I want us to do next is reach out here. We're going to press through this hand
Okay.
So we'll be pressing on the right, and we're going to shift our hips to the left and swivel towards the edge of the bed, okay?
Okay.
All right?
Okay.
Let's actually bring this a little bit closer.
Okay.
All right? And you can create movement with your head.
Okay.
Going towards your right. So, good. 1, 2, press. Good. And then what you can do is bring that arm back.
Okay.
You can bring there. Yeah, there we go. Put that underneath there. Pull, pull, pull. Good, good, good. And we're going to do one more shift towards the front, okay?
Okay.
So let's bring these here,
Okay.
a little bit closer in, and what I want you to do is I want you to press on 3 through both of these arms using these muscles, okay?
Okay.
All right? Okay. Ready?
Yeah.
So 1, 2, press as those are. Good. Want you to hold on right there. You just let those legs hang. Okay. So next, Scott, I'm going to be getting a gait belt on you
Okay.
and your shoes on you before we move into that chair, okay?
Okay.
So I'm going to lay back. So you can take this hand right here. This hand right here. Okay. Back. Good. How do you feel?
Good.
Okay. Put your arms right here. You still awake?
Mhm.
Okay. All right, Scott. How you feel?
Good.
Good? Okay. So now I'm going to raise you back up, okay?
Okay.
So I'm going to go up on 3. Okay?
Okay.
So 1, 2, 3. Good. Let's bring our arms back out for support. Okay. So next what we're going to start doing is transferring towards the edge of the chair, okay?
Okay.
And we're going to be doing that by doing something similar to what we were previously doing, pressing through one side and shifting our hips the other way.
Okay.
Okay?
Okay.
All right, Scott. So let's start with bringing this hand close towards our side.
Okay.
With this hand, yep, a little bit further away. Okay? And then I want you to look this way. I'm going to be providing you some help shifting to your right, okay?
Okay.
So on 3, we're going to push to the left, okay?
Okay.
So 1, 2, 3. Okay, good. And what we're going to do is we're just going to reposition. So let's do one more shift
Okay.
before we start getting on that board. Okay. Closer, straight. Okay, and we're going to go on 3.
Okay.
So 1, 2, 3. Good. Okay. Alright, so next, Scott, with that arm right there, what I want you to do is I'm going to assist you. We're going to go down onto this elbow so we can slide the transfer board underneath our thigh, okay?
Okay.
So, okay. Right. There. Alright, Scott. And then we'll bring our hand onto the transfer again, hand close.
Okay.
Need you to really press through there
Okay.
so we can get onto that board and start sliding over towards the chair, okay?
Okay.
All right, we're going on 3.
Okay.
So 1, 2, and press. Good. Yep, make sure to keep those fingers bent and keep this arm straight.
Okay.
And then we just do one more slide into the chair, all right?
Okay.
Okay, here we go. You ready?
Yes.
All right. So 1, 2, 3, press. Good. Go. And then what I'm going to have you do is we can lean over towards this side. Good. Slide that. Okay. And we're a little bit forward, so I'm going to have you help me. So I'm going to have you push into these elbows so we can help lift your body weight up a little bit. And I'm going to press so we can sit further back.
Okay.
All right. We're going to go on 3. Okay.
Okay.
So 1, 2, press through those elbows. Good. How do you feel?
Good.
Awesome. So next what we're going to do, Scott, is I'm going to teach you about some pressure relief. So it's going to be important for you to shift your weight every once in a while. The rule is for every hour of inactivity, you want a minute total at least of pressure relief. And you can break that up doing 30 seconds every 30 minutes, or you can do 15 seconds every 15 minutes. So as long as you're getting those seconds in, you'll be good.
Okay.
Okay? And so what that can look like is taking this arm, and you can bring your hand underneath here, and you can, using your arm, you can pull and lean. We want to make sure that you're yep. And so that you're clearing each side. Okay. And we're going to do the other side. So you can bring your hand right here. There you go. And you can lean, and you can use your other hand too to pull. And this will shift, yep, it'll shift your hip, your opposite hip up off the seat and give relief there. Okay?
Okay.
You can also do, you can bring your arm back, hook your arm there, and then lean and pull to this side so you can still